Hi, everybody. It is so great to be with you today. I am actually going to start with the dose of vitamin G for gratitude. We've got so much research on these positive effects. If all of us would just get up every morning, think of 2 or 3 people we're grateful for. Do that again before we go to bed at night. Put gratitude boards in our units, places of work. We would so experience improved mood, heart health, optimism, sleep, and our blood pressure would be better too. So I want you to take just a few seconds and write in the chat box who or what you're grateful for today. I am grateful for each and every one of you, for the care that you deliver, for the education, the evidence-based practice that you provide. You truly are making the world a better place. Well, in 2017, the National Academy of Medicine said, we've got a public health epidemic of burnout, depression, and suicide in physicians and nurses and other healthcare providers. We've got to do something about this. So they launched what's called the Action Collaborative for Clinician Well-Being and Resilience. I was blessed to be appointed as one of 60 leaders throughout the country on this Action Collaborative. We are working so hard to improve this situation throughout the country. We've gotten a lot more visibility on this, especially with the C-suite throughout the country, as well as legislators. And last November, NAM put out this consensus study, Taking Action Against Clinician Burnout, with 6 system fixes that are really important to improve this situation. On Saturday, we published a landmark study on critical care nurses' physical and mental health, worksite wellness support, and medical errors. This particular study's findings has gotten so much media attention throughout the country, including NPR, Modern Healthcare, and Medscape. And I am going to keep beating the drum on this issue, because if our nurses are not in optimal health and well-being, they're going to suffer. Their families are going to suffer. And our patients also will suffer. In this study, we chose a random sample of critical care nurses across the United States. And I'm very grateful to the American Association of Critical Care Nurses for collaborating with us on this study. The findings were pretty disheartening. Almost 40% of these critical care nurses are suffering from depressive symptoms. 53% met the cutoff for clinical anxiety. And we used valid and reliable scales, the PHQ-2, the GAD-2, to measure anxiety and depressive symptoms. 60% of these critical care nurses reported suboptimal quality of life. We also looked at the relationship between physical and mental health and medical errors. These were self-reported, but if you look at a lot of studies, self-report, some people believe it's a better, more accurate indicator of errors because it's anonymously reported. And unfortunately, sometimes in our healthcare systems, because people fear what might happen, might not get reported. As you'll see on this slide, nurses in better physical and mental health made fewer medical errors. The other thing we saw in this study that replicated findings from an earlier study, if nurses said they believed their healthcare site was supportive of their wellness, they had better outcomes. So perceived support is super important. And of course, building cultures of wellness that make healthy behaviors the norm is critical. Right now, we have a mental health pandemic that's happening within the COVID-19 pandemic. Not only for our nurses, physicians, but also for the American people. Healthcare claims from a recent study just showed clinical depression and anxiety have increased 3- and 4-fold since the pandemic. Well, we know healthcare providers suffer from the terrible twos: too much stress, too much work, too many tasks, and too little time for self-care. System issues like poor staffing, long work hours, the electronic health record problems must be fixed for these situations to improve. The other thing that COVID has triggered is a lot more unhealthy lifestyle behaviors. In an attempt to cope with COVID, we have seen increases in unhealthy eating practices, increases in alcohol use, other substance use, and declines in physical activity. In fact, there is some joking around about the COVID-19 meaning 19 pounds of weight gain. So I'm looking for studies right now to document what has been standard weight gain during COVID-19. Well, if you're not depressed, but you're not thriving either. You could be what is called languishing. That's somewhere in the middle of the spectrum when you're not depressed, but you're definitely not thriving. Maybe you're feeling just fatigued, worn out, not wanting to get on another Zoom call. Those languishing in 2020 were 3 times more likely than their peers to be diagnosed with PTSD. And one solution that's recommended for languishing is to choose, when we get up in the morning, pick one meaningful task that's pretty simple that we can accomplish pretty readily. Small wins during this pandemic are super important. So I want you to look closely at this one item, valid burnout scale. And I just want you to reflect upon, how would you rate your current level of burnout? If you fall into the 1 or 2 category, that's great. Maybe you do take a little bit more time to prioritize your own self-care. If you fall into the rating of 3, I so encourage you, please start squeezing out a little time every day to take good self-care. Self-care is not selfish. It is absolutely necessary to take good care of our families and our patients. If you're falling into the rating of 4 or 5, please seek some mental health help before it gets to be a chronic, serious condition. It is a strength to recognize when we need help, to seek it out. It is not a weakness, but we still have way too much mental health stigma, because we know the consequences of burnout are several. We have so many studies that support when we are burnt out, our risk for occupational injury goes up, for problematic alcohol use, for depression, for suicide. We really have studies to show when clinicians are burnt out, their morale is lower, their productivity is lower, there's more presenteeism. That's showing up for work, but not being fully engaged and in the moment. We also know burnout compromises the quality and safety of healthcare. So many studies that show this. What we've got to help C-suites across America realize, if they don't invest in their people's health and well-being like we do here at Ohio State, their rates of these problems are going to stay high, and it's going to cost their organization a lot of spending that is not necessary. Well, as part of the NAM Action Collaborative, our team conducted a systematic review of evidence. We know what works for clinicians, for nurses, for doctors. What's essential is that we translate what we know works from research into clinical practice to improve care, to improve population health and well-being. We know mindfulness works. Mariana Klatt's program, Mindfulness in Motion, is fabulous. And we get it. She gets it to as many people as she can. Health coaching works. We got terrific health coaches. Gratitude works. No matter where you work, I'd encourage you, put up a gratitude board. So when people come in every day, they can put up one or two things they're grateful for. We know cognitive behavior therapy, skills building works. We've got our evidence-based Mind, Body, Strong program that is scaling now all throughout the country. Again, let's do what we know works based on best evidence. Another simple, brief practice, deep abdominal breaths, we know work. We know visual triggers help to remind people to do certain things. So again, once we know something works, we got to translate it. We also know from a lot of research, the longer the shifts, the poorer the health of clinicians, including nurses, and the more medical errors that are made. We are working right now with the Ohio Nurse Leader Organization. We've got to do more to elevate this issue throughout the state, and again, to translate what we know works into practice. Self-care is not selfish. It is absolutely necessary for safe and great care of others, because we cannot continue to pour from an empty cup. So when COVID hit, I really wanted to come up with brief evidence-based strategies that could help people to reduce their stress and improve mood. So we have Cope with COVID. If we can get everybody to do these tactics regularly, we would see so much more mood elevation and decreased stress. We also started a Stay Calm and Well series. All those recordings that are 30 minutes long with skills building can be accessed at this link. I'd encourage you and your teams, look at these fabulous lectures with skill building activities. Maybe pick one every 2 weeks, have everybody watch it, and then do a debrief of 5 to 10 minutes to check on people and see how they're doing with their skills. We know, again, from research, if we build these resiliency skills in our clinicians, they will have better physical and mental health. So we've got to not only fix system issues that lead to burnout and depression and stress, but we've got to build these resiliency skills in our people. If you haven't taken a resiliency assessment yet, I'd encourage you, go to this Everyday Health website, There's a valid and reliable resiliency scale by Amit Sud there. You can take it, you get a score, and you'll get tactics for how to improve that area of resiliency. Well, we know cognitive behavior therapy and skills building is the best first line evidence-based treatment for mild to moderate depression and anxiety. But so few people get it. In fact, research shows less than 25% of people affected by depression and anxiety get CBT or CBT skills building. In CBT, we teach people all about the thinking, feeling, behaving triangle, because the root cause of a lot of depression and anxiety is automatic, negative, unhelpful patterns of thinking that people don't even realize they have anymore. So as part of our Mind, Body, Strong program, we teach people how to catch, check, and change these automatic negative thoughts. I will ask you for the next week, when you feel angry, depressed, anxious, or stressed, just stop and say to yourself, what was just going through my mind? Is that thought really true? Is it helpful? And do I have the evidence to back it up? 99% of the time, the answer is going to be no. So the key is catching those thoughts, checking them with these questions, and changing the negative to a positive so we feel emotionally better. I adopted a habit 30 years ago that I still do today faithfully, and that is to read 5 minutes, just 5 minutes in a positive thinking book every morning and every night. And if you're one person that says, I have no time in the mornings to do it, put that by your toilet. When you get up, you go to the bathroom, you pick up the book, at least read a couple positive minutes. It so helps to protect us against negativity we might encounter that day. So Marlene Sampson, one of my wonderful PhD students, decided she wanted to do a randomized controlled trial to test this CBT-based program with new nurse residents. She did a great job. What we learned in this clinical trial was the same thing that was learned through 20 prior studies. When people receive this CBT-based program, they have less stress, depression, anxiety, and job satisfaction 6 months after they complete the program. 2 weeks ago, Dr. Jackie Hoying, who directs the program, and myself did a training for people all across the state of Nevada because they have gotten funded by their governor to make sure that this program is offered to clinicians all throughout the state. Mindfulness works, and a good activity when you feel you're worried or you're stressed. Stop, look to the left, move your neck very slowly to the right, taking in what you see, what you hear, what you're experiencing. Worry about the future, guilt about the past are the two most wasted emotions. Is your mind full of all the things you need to do today? Or are you mindful in the present moment? Learning to be mindful so helps us to decrease our stress. Well, we know, we're told 20 minutes hand washing. Use that time. And I meant 20 seconds because 20 minutes would be a heck of a long time to wash our hands. But use those 20 seconds to take a deep abdominal breath using the 5-7-8 technique. That technique is super important to cut sympathetic nerve stimulation. When you breathe in, count to 5, hold it for a count of 7, breathe out slowly for a count of 8. You can even add positive self-statements to that method. As you breathe in, you might say, I am calm. As you breathe out, I'm blowing stress out. If we could get everybody at our university and medical center, everybody throughout our state, everybody throughout our country to just engage in these behaviors, we could cut our risk of chronic disease by 80%. This is a simple evidence-based recipe, but it's not easy because behavior change, even in ourselves, is what I call character building. You might say, there's no way I can do 30 minutes of physical activity 5 days a week. And I will say, yes, you can. Cut meetings from 60 to 50 minutes to give 10 minutes of micro recovery break time, to dance to music you like, walk some stairs, take a brisk walk, do some physical activity. Even 11 minutes a day has been shown to have heart health benefits. 5 fruits and veggies every day. I do that most days with a smoothie. Not smoking, and if you drink alcohol, limit it to 1 drink a day. Then everybody asks me, how big can that drink be? And I tell them, not the size of the alcoholic beverages we get in Vegas. We make behavioral choices every day. What's going to motivate you to take the healthier choice? A group of psychologists studied, this is a real fitness facility in the state of California, how many people chose the steps versus the escalator to go work out at the gym. They found just 2 people a day. Again, sadly, if we don't make healthy behavioral choices today, if we don't take the time for good self-care today, we are going to have to take the time for chronic disease later. I want to just share some very important energy management principles. I bet most of you wish you had more energy. Physical, emotional, mental, and spiritual. Those are 4 energy dimensions. I used to pride myself on being the best multitasker in the world until I attended the corporate athlete program and found out multitasking is the enemy of extraordinary energy. Now, I don't do it the majority of my days. The other thing I want to ask you today, are you aligned with your dreams, your purpose, your mission in life? If you are aligned with your dreams, your purpose, your passion, you're going to be excited to get out of bed on Monday mornings and say, I'm so excited I get to work today. When we are not aligned, that's when our energy really is zapped. That's when we aren't excited. If you're aligned, you never feel like you work a day in your life. Stories we tell ourselves are also very powerful. Changing our story is key to changing our life. If you have not been through our health athlete program, I really encourage you to go through it. You will so benefit. So I want to conclude by saying an ounce of prevention is worth a pound of cure. Unfortunately, we still live in a very sick care dominated healthcare system. We need great sick care. That's true. But our country only invests 8% of our healthcare spending in wellness and prevention. It's no wonder we rank so low in our health outcomes. So again, please, if you're suffering from depression, stress, burnout, anxiety, and it's interfering with your judgment, concentration, or functioning, seek out our employee assistance program or our STAR program. Wonderful resources are here for you at Ohio State. And if you didn't make a January 1 New Year's resolution, pick one of those behaviors in that evidence-based recipe I gave you and commit to getting a little better at it. Don't leave my talk today until you write a new health goal down. It could be just, I, Bernadette Melnyk, am going to increase my physical activity from 10 minutes twice a week to 15 minutes. Put it where you can see it every day to remind yourself, to motivate yourself to do it. Lastly, join us in our Be Kind, Mask On, Mood Up movement. Every time you put on your mask from now on, I'm asking you to do 3 things. Take 3 abdominal deep breaths using that 5-7-8 method. Be kind to yourself. Pick a positive self-affirmation statement. Say it out loud 10 times, like, I'm too blessed to be stressed. And give a dose of vitamin G to somebody else. When you put on the mask, think of somebody you're grateful for. Turn around, call them, text them, email them, and tell them why. Well, I was 15 years of age when I lost my mom. She sneezed, stroked out, and died right in front of me. But the really sad thing about my mom's story, she had a history of headaches for over a year. And my dad kept saying, please go to the doctor, figure out what's wrong. She went to her family physician just 1 week before she died. She was diagnosed with high blood pressure, given a prescription for a blood pressure medication that my dad found in her purse after she died. She never filled it. And think about this. 1 out of 2 people with high blood pressure today don't have it under control. And it's the biggest risk factor for a heart attack and stroke. These 3 daughters, my husband, my 2 little grandsons, are my motivation. When I get up in the morning and I don't feel like exercising or eating healthy, I put their faces in front of me. They're my motivators. Who will be your motivators? People who want you around for a really long time. As we are winding down the pandemic, it is critical. We got to keep dreaming, discovering, and delivering a healthier profession of nurses and other clinicians, and taking great self-care. And if I couldn't motivate you enough, this little girl will.
Do it! Just do it! Don't let your dreams be dreams. Yesterday you said tomorrow. So just do it! Make your dreams come true. Just do it! Some people dream of success. And you're going to wake up and we're going to work hard at it. Nothing is impossible. You should get to a point where anyone else will quit. And you're not going to stop there. No, what are you waiting for? Just do it. Just do it. Yes, you can. Just do it.
Love that. So with that, I can stick around and I'm willing to answer any questions.